A very warm welcome to all those who are watching this video. I am Tanaya Kulkarni and I will be talking about Childhood Disintegration Disorder. Let's take a deeper dive into understanding what exactly CDD is. CDD is also known as Heller's syndrome, disintegrative psychosis of childhood, dementia infantilis, and pervasive developmental disorder. But what exactly is CDD? It is a rare disorder characterized by a later onset, usually after the age of 3. It is characterized by developmental regression in various segments of life such as psychological, physical, social. CDD was discovered by Thomas Heller, because of which it is also known as Heller's syndrome. He discovered CDD in 1908, which was way before the discovery of autism. Today, CDD is considered to be a part of the autism spectrum disorder.
As discussed previously, those with CDD develop normally for the first few years of their lives, but the development disintegrates at a varied speed. Naturally, this disorder impacts most areas of their lives.
Their motor skills might be severely affected, fine motor and gross motor. In fine motor, they might not be able to write anymore or hold things with their fingers, while in gross motor, they might not be able to walk properly the way that they used to before. CDD also marks a deterioration in their play skills. So playing by themselves or even playing with others, such as playing with dolls, sharing with others, things like that are also hampered. Next is social functions. This involves interacting with other people and acting in socially acceptable ways. However, kids with CDD have deteriorated social functions and they aren't able to interact with others in a way that they used to before. Next is language. Kids who have CDD initially may have learned how to say a few words and even sentences. However, when the regression starts, they aren't able to do so anymore. Sometimes, in extreme cases, the child may even become mute ultimately. The next thing that is affected is social skills. Kids with CDD might have a problem interacting with their peers, talking to them, asking questions, interacting on a daily basis, even sharing, things that typical children do. It might be difficult for them. Lastly, bladder and bowel control. Kids with CDD might have little to no control over their bowel movements and even their urination. They might require support from their parents with regards to this. Let's take a look at how CDD might affect the quality of life of the child. Let's look at it in three aspects. One is physical, second is social, and third is psychological. Let's look at the physical aspects first. Children who have CDD might experience severe seizures, which might hamper their daily activities, and they might require constant support and even medical assistance. The second thing is that, as I mentioned before, they may have trouble controlling their bowel movements and urination. Hence, they need a parent or a caretaker with them at all times. As mentioned earlier, their motor skills are impaired and mobility might be an issue for them along with other activities of daily living. Lastly, under the physical aspect, they might engage in behaviors that are stereotypical and repetitive, which might include bobbing of their head, running around in circles. They would keep doing a particular behavior for a long time. In addition to that, there are several psychological aspects of the child that get hampered in a child who has CDD. Initially, when the symptoms just start, they might experience anxiety, they might experience terror, and they just seem a little bit scared. So along with that, they might also have nightmares and a lot of confusion. So these are a few starting signs that you can see in a child when neuroregression is just about to happen. Under the social aspect of the child's quality of life, we can see that the child is no more able to engage in non-verbal and verbal communication with others. It is difficult for them to read others' cues as well. Interacting with their peers is difficult, hence they won't be able to play with them as such. You can see that they are lonely quite a lot of times, and other kids also don't engage with them as much. CDD has no known cause and no known cure as well. However, there are a few treatment options that can help curb the symptoms. We will look at these interventions in two aspects. First one is pharmacological and second one is therapeutic. Let's look at the pharmacological interventions. We have two types of drugs for that. First one is atypical antipsychotics and second one is SSRIs. Under atypical antipsychotics, we can see that the child's aggressive behavior, disruptive behavior can be curbed. It works on dopamine pathways, and one of the examples can be risperidone. Second one is selective serotonin reuptake inhibitors. These work on depressive symptoms, and it may also help to curb seizures along with other neuroleptics. Some of the therapeutic interventions may include speech therapy. Speech therapy might help the child communicate with others, with their parents, with their friends. It may also focus on articulation and using words to communicate what they want. The second one can be occupational therapy. This therapy is extremely important because it might help recover their activities of daily living. The next intervention is using applied behavioral analysis. This uses the techniques of behavioral therapy to bring about a desired outcome in the child's behavior. Lastly, we look at social skills training. Here, the therapist might teach the child how to interact with their peers and how they can communicate with them effectively. Unfortunately, there is no cure for CDD. That's why they might require long-term care. This includes care for adaptive skills, intellectual functioning, motor functioning, mobility, and things like that. The life expectancy of someone who has CDD is considered normal. However, if they have seizures, this might be an added risk to them. Families who have a loved one with CDD might engage in certain support groups. There are support groups for people who have autism, and these might help them understand how to deal with such patients. It comes off as a shock to parents because the child usually completes all their milestones up to the age of 3, and suddenly they start losing out on the skills that they've previously learned. For example, if a child has learned how to walk, talk, there might come a point after which slowly the child would start saying a few words, would have difficulty walking, etc. This brings us to the end of our video. Thank you so much for watching.